Welcome back to Point of View, where we present all sides of a story, including yours. Tonight, a major topic of debate, the Affordable Health Care Act. Host Chris Berg brings three big players into the hot box to talk about its impact on you. Chris?
Good evening, gentlemen. Welcome to this healthcare roundtable. Obviously, a very, very hot discussion. Paul, I want to start with you. I watched you travel the state recently, and you talked about how right now the average North Dakotan is spending almost 25% of their income on their premiums, their health insurance premiums. And yet we all thought that this Affordable Care Act was obviously going to drive down our personal costs. You recently said in an interview that that's not the truth. It's going to go up $65 for an individual and $200 for a family, correct?
Right. We don't see the Affordable Care Act really reducing the cost of health insurance. The real issue is how much our health care costs. So we don't expect this law to reduce the cost of health care. That's why we're taking initiatives on our own to reduce the cost of health care.
Like what specifically?
Well, two areas. First of all, helping people live healthier lives, helping people take more responsibility for their own health. And the second is working with the healthcare system, with hospitals and doctors, to be more efficient and more effective in what they do.
So this is where I always see the rub. Let's be honest here. They always say in politics, follow the money. So you're going to say, hey, Chris, we're going to focus on health care. Kevin, you're with Essentia. Obviously, the healthier people are, they're not spending time in your hospital. You're not making as much money. How do you guys make that work together?
Well, the reality is there's so much involved in healthcare delivery now that is either uncompensated or, we're reimbursed, but we're at risk as a healthcare organization to ensure people have not only good outcomes while they're in the hospital, but also, post-discharge, and that, they don't have a recurrence of readmission. There are a number of programs, whether it be on the government level or with our commercial insurance partners like Blue Cross Blue Shield of North Dakota, where we're working collaboratively really to look at kind of that total cost of care of a patient. So you're focusing on chronic disease state patients, you're focusing on readmission rates, you're looking at ensuring really a full continuum of care. You're using care coordinators for people with very intense healthcare needs, to where they're working very hand in hand proactively versus dealing with an acute episode.
But I think this is the thing. I look at our system, and everyone calls it a healthcare system. I call it a disease management system. Mm-hmm. Isn't it true that the more people are in dis-ease and spending time in your hospital, the more money you make?
Well, the reality is not necessarily, because again, how we get reimbursed is both from the standpoint of certainly taking care of acute episodes, but we've really evolved from a payer environment to us, commercial and governmental, that is putting us actually more at shared risk. We're working collaboratively to ensure not only quality, but also overall health, improving the health status. And with that comes certainly the ability to avoid costs. I mean, we're very expensive places to operate, and actually avoiding those costs that are not always compensated or reimbursed, whether it be an uninsured individual or because we're paid a fixed rate for services. It actually is to the benefit that we work in partnership with employers, with schools, with payers, commercial or governmental, to look at health status and try to improve that. Again, we're healthcare organizations. We're just not a deliverer of an acute care environment.
Chris, can I jump in?
Please, I want everybody to jump in anytime.
I think Kevin's being a little too modest. You're right. If Essentia helps keep people healthier, it's going to reduce the number of people in the hospital and reduce the revenue. But Essentia really is going ahead and doing that anyway, and we're working with them to reward them for doing that. We think if they do the right thing by the patients, which they are, we can reduce the total cost of health care, and we still want Essentia and other high-quality hospitals available for people when they need them.
One of the things I heard you say recently as well, Paul, is you said, you know what, a hospital actually loses money off every Medicare patient. Is that accurate?
Yes. Medicare underpays hospitals in North Dakota, so they lose money on Medicare patients. They make money on Blue Cross patients and other private insurers, and barely break even in many cases as hospitals.
So the Affordable Care Act pulls $500 billion out of Medicare. How do we increase outcomes or even keep them stagnant? But yet we're going to have more people going into Medicare. We all know that demography is destiny. How is that going to work? You got less money with more people, and we're going to try to keep the outcomes. Doesn't seem to add up. Kevin?
I think you could run for president if you knew the answer for that. You'd probably get elected. But the reality is there is no magic bullet answer to that. And it isn't just actually in expanding enrollment of Medicare. I mean, really, when you look at Accountable Care Act, it actually is expanding the insured base. And how those people may be reimbursed could be at a Medicare-based reimbursement, but it also could be as well at a commercial rate or some mix or blend of that, with incentives certainly for performance of quality and health status and other things. You're certainly, we have an aging population, so Medicare will expand from that standpoint. But the other reality is, and actually, Craig or Paul can comment on this, is there still is ways in which we can improve the efficiency of healthcare delivery. We provide a lot of services because we're doing it in an acute environment versus doing it on, focusing on preventative dollars, focusing on overall health status, avoiding those chronic diseases from manifesting to be very intensive, very expensive encounters. And we can do better, whether it be us at Essentia or healthcare organizations in general, and that takes cost out of the system. And so there is savings to be gained from that.
We've all heard about the taxes that are going to be coming out because of the Affordable Care Act. When we come back, we're going to get a chance to hear from Craig Whitney, president of the Fargo-Moorhead-West Fargo Chamber. What's going to be the impact on businesses and you right there at home? Stay close. More coming up from the Healthcare Roundtable. Healthcare Roundtable. Gentlemen, thanks again for your time. And if you can continue to talk to me like I'm an 8th grader to make this simple for myself and obviously everybody at home. But Craig, I want to get a chance to hear from you. You represent a lot of small businesses in the area. You hear about the sort of Pandora's box around the Affordable Care Act, the taxes that are going to take place. What taxes are going to impact businesses, and what kind of impact is that going to have?
Well, I think, Chris, we're still kind of waiting to hear on a lot of those kind of details. But, we're hearing from a lot of our business members that the concern is not knowing when the next shoe is going to fall, not knowing exactly how this is going to affect them. Of course, 90% of our members are small business owners, 50 employees or less, and will not, for the most part, be affected by the larger parts of this piece of legislation. However, what we are concerned about and what we are hearing about are from mid-sized small business. In other words, companies that may have somewhere around 35 or 40 people. And they're thinking about expanding, perhaps. Our economy here is obviously far different than the rest of the country's, and there's a lot of those companies that are looking forward to expanding. They have the ability to do that, but they're waiting to find out how that might affect them in terms of going above that 50 employee number.
Recently, Papa John's came out and said that the Obamacare or Affordable Care Act is going to increase each pizza about 20 cents. Doesn't sound like much, but again, I think if you look at the economy as a whole and everything starts to drive up the cost, it's going to impact people. So my question to you is, how many businesses do you think are going to say, you know what, we're going to take this penalty and people can go find their own insurance?
I think that could very well be the case. There could be a lot of them.
Wow.
But again, I think there's so many questions that are still unanswered about this. Kevin and I were talking about the rules for this law have not been written yet. So, nobody really knows everything that's coming down.
Can you say that again?
The rules that have to be written by all the different branches of government, the different departments, have not been written yet. So there are so much information that is not known about this yet, that when people ask questions like how much is this going to cost, how much will it affect people, people that can't answer that are not being evasive. We don't know.
I mean, one of my big concerns is you hear about all the cash that companies are sitting on. We all know in July, unemployment went up to 8.3%. Look, a company's not going to take and part with that hard-earned capital if they don't know what the costs are going to be. And I just think somehow we've got to get our hands wrapped around this. And Paul, speaking about business, how do you run an insurance company when people can go, I'm just going to pay the $95, $65 tax, whatever it is. Then if something happens, I'm going to go get insurance to get myself covered. That doesn't bode well for your business model.
That's a really good point, Chris. One of the most controversial parts of this law was the insurance mandate on both individuals and business.
The tax, you mean, right?
Right. But that's right. It's not a mandate, it's a tax. Good point. I learned that from the Supreme Court. But this requirement, this tax, is relatively low compared to the cost of insurance. So we are worried that healthy people will drop out of the insurance system knowing they can come back in anytime they get sick. And if that happens, then the cost for everybody is going to go up. And we are worried about that. You talk about small business. Craig is right that we don't know all the details yet. But we are preparing as Blue Cross Blue Shield of North Dakota to provide an advisory service to each and every one of our employer customers to help them understand the implications as we get those facts.
I want to get your thoughts on this. The most recent CBO estimates that it's actually, Affordable Care Act is actually going to save more money than originally anticipated. Here's a couple of things I want to share with you and then get your comments. In 1965, the CBO estimated that the subsidy for Medicaid was going to cost about $100 million by 1992. Instead, it was $11 billion by 1992. Amtrak recently lost $833 million the last 10 years just trying to run food and beverages. And yet we're going to expect our government to give us, number one, accurate assessments from the CBO, and number two, run this thing efficiently? Am I missing something, or Kevin, I'll start with you.
Yeah, I mean, again, you look at the revised CBO estimates, that actually is post the Supreme Court ruling that basically said you couldn't enforce the Medicaid mandate, which would require states to expand their Medicare eligibility to 133% of the federal poverty level. Well, by doing that, states are now deciding whether or not they're going to opt out of that. By opting out of that, the savings come because that means the number of uninsured that were initially projected to be covered under some type of plan, whether through an exchange or a federal sponsored plan or whatever, is now gone down. And so there will be more people who will remain uninsured. Therefore, the federal government will not have to fund the Medicaid expansion, and therefore they literally create.
And yet, Paul, correct me if I'm wrong,
Right.
that means that my premiums go up because I've got to end up subsidizing them because they're not being covered, so you end up paying for them, and then I pay the insurances to cover that, correct?
Well, and then from a healthcare organization's perspective, there are also other components of the law that went away because of anticipation that the number of uninsured would go down. So there's no longer what are called disproportionate share payments. There's $155 billion give back by the healthcare organizations, basically for giving back our market increases over the next 10 years because we would not look at as much uncompensated care coming into organizations. Well, that's not the case anymore.
Does this sound complicated enough for you?
You know, I'm going to get to this. We are going to do a web exclusive piece here after this where we're going to talk about how do we screw this thing up so bad, but I do want to give each of you, if you can briefly, because I do want to take a minute here and talk about the exchange as well, at least Paul, to get your comments on it, but the CBO estimates and the fact that Amtrak can't run this incorrectly. I'm going to let Craig answer this. We'll get to you about the exchange, but I mean, Craig, you're a business guy. Is this thing going to cost us way more than they're saying?
Absolutely, absolutely. And you know, I know Paul's going to talk about the exchange, but I just wanted to remind people that the chamber was very active in trying to have a state-run exchange. And you know, I think sometimes the political leadership has focused on the fact that, or hasn't focused enough on the fact that this is a law. This is no longer a debate about whether this legislation that passed in March of 2010 is good or bad. This is currently the law. And we felt for sure, and I think both Paul and Kevin as well, that a state-run exchange was far better than turning it over to the federal government. And that segues right into your question about running Amtrak and food on Amtrak. Yeah. It would have been much better to have it run here locally, more state control.
And the thing that, again, I think people want certainty. The thing that freaks me out is you talked about a state exchange. I can't really tell you what that is. And I would presume many of you out there can as well. So stay with us. I want you to go to 630pov.com. Again, 630pov.com. We're going to start off the web exclusive interview. Paul von Ebers, CEO of Blue Cross Blue Shield, is going to explain what in the world is a healthcare exchange. Yeah. Is it good for you or not? Go to our website right now.
All right. And once again, you can go to 630pov.com to see the next portion.
Thanks for staying with me on our web exclusive interview. Gentlemen, I appreciate you again, your extended time as well. Paul, we left off there talking about the state exchange. And I think there's a lot of people talking about it. I'm not the smartest guy out there, but I also feel like I kind of have a pretty good idea what's going on. I can't explain this, so help us understand what it is.
Okay, first of all, let's just talk about an exchange. What is it? And then we'll talk about a state or a federal. An exchange is an online marketplace to help you buy health insurance. It's a good idea. I mean, a lot of people do online shopping today. People shop for cars, clothes, all kinds of things online. And the notion here is to give you a place where you can go on the internet and compare health insurance plans one to another. And there's nothing wrong with that idea. Good idea. Now the question is, how should we do it? This law gives two options. A state can set up this exchange, and they can cooperate with other states to share the cost if they want. But you can do it at the state level, but if a state doesn't do it, then the federal government will do it. Our concern about a federal exchange is, essentially, we're saying you have to go to a federal store to buy health insurance, and that the federal government is going to say what's going to be on the shelves and what the prices are and so on. So we don't like the idea of a federal store. We think North Dakotans can figure this out better.
In the state exchange, would that start to increase competition across state borders? Because currently you can't do that, correct?
Yeah, it should increase competition.
Well, that's a good thing then, right?
We're the dominant insurer in North Dakota, but we're not afraid of competition, and we do expect to see more health insurance companies offering products in North Dakota because of the exchange. It lowers their marketing cost. It's easier to get their message to people. So it's cheaper to do business here with an exchange, and so we think more people will offer products. That's a good thing, and we think it will benefit consumers.
Speak to me about this, because it seems like almost, I don't want to say a conflict of interest, but towards a monopoly, if you will, Sanford being in the hospital business and the insurance business.
You know, that's a great question. Sanford is a worthy institution, and they have a good health plan, and you know, we're happy to compete with them on a fair and square basis. The question is really, is a health system ready to control healthcare costs?
Clearly not.
You talked about that earlier. You know, more sick people means more revenue for a health system. Is a health system ready to really take on the responsibility to control healthcare costs? And who represents consumers in that environment? You know, we think that it's good to have a private, not-for-profit health insurance company representing consumer interests.
Kevin, I want to get your thoughts with Essentia. Am I missing something here with them doing both? Or?
Well, I think from a, and I'll talk about Essentia's experience. I mean, there was recently we were selected by CMS to participate in what's called the Medicare Shared Savings Program, which you've heard about accountable care organizations, and it actually is. It begins to look a lot like we take some insurance functions. In other words, we become at risk, at least on a shared basis, with the federal government for Medicare beneficiaries or a defined population. I would concur, though, with Paul. I think there are a lot of healthcare organizations who are going into accountable care organizations blindly because they are concerned if they do not, they will be shut out of certain populations of patients being able to provide care to them. And I think they're doing it, you know, without truly understanding not only the insurance risk, the actuarial risk, and really the long-term consequences it could have to organizations. And so I think they have to tread very lightly as they go through that. And certainly in our organization, we continue to wonder, is this the right direction? It should be something we should be involved in.
Kevin, I'm going to put you on the spot here. I talked to a doctor a while back out of Minnesota, no longer takes insurance, and says, hey, she's doing just fine. Her patients are getting better, her costs are staying low. A lot of people pin administrators as the reason that these costs are going up so much and why a hospital bed is $10,000 or whatever those numbers are. You say?
I say it's, I think, one, to fully understand the economics of healthcare delivery, unfortunately, it isn't as simplistic as those statements. And whether you look at the 24/7 environment, the federal requirements that we provide emergency access, we run an emergency room, the fact we can't turn away patients, and so you're providing care that may or may not necessarily be required because of their physical condition. But the other part is it's an expensive environment in which to do it. Can we do better? Yes. I mean, and I think if a healthcare organization says that they're really efficient, my reality is I think we all have opportunities to do better.
So what's driving these costs? I mean, and Craig, I want to give you a chance to jump in here or anything, but it just seems to me that, and another thing you said a while back, Paul, is you've got 20% of the people driving 80% of the costs. I mean, do we already live in a socialized medicine society?
Well, we do live in a shared cost society right now.
Well said.
Well, even with private health insurance, Chris, you've talked about how you're healthy and you don't spend a lot on health care, yet your premiums keep going up. That's because we have other customers who have serious health care problems, and yes, you are supporting some of those other customers that we have.
So isn't that socialized medicine?
In a way, it's a private version of it. What we need to do is balance out personal responsibility and things you can't control. Like you can control what you eat and whether you do exercise or not and whether you follow your doctor's orders. You can't control whether you get a genetically based cancer.
So I want each of you to explain this to me. There's two areas right now in medicine, healthcare, that actually costs are beginning to decline, and that's LASIK surgery and cosmetic surgery. In my opinion, why? There's competition. I can shop doctors. I go across states. I pay with a credit card or cash. Back in the 60s, we had a similar situation. I mean, how did we screw this thing up so bad, and why are we not expanding HSAs rather than diminishing them through the Affordable Care Act?
Well, because that part is an insurance question, I'll take that. HSAs, or health savings accounts, are actually expanding here in North Dakota right now, and we offer them today. You're right, the Accountable Care Act does put some restrictions on them. We think that's a bad idea. We do think that health savings accounts can improve individual accountability for their own care and shopping. Now, we do think that people aren't going to necessarily want to shop for the lowest price surgeon when they need a life-threatening or a life-saving surgery. But there are elements of healthcare that people could shop for, and we'd like to encourage that kind of shopping.
And Craig, I know you're politically savvy, correct me if I'm wrong, but I thought like Karl Rove and George Bush started to implement in, I think it was 12 different states, really expand the HSAs, and they started to drive costs down. Is that accurate, or am I misinformed?
I would turn to the experts on that. They would far better be able to answer that question.
I think there's, and again, from a healthcare provider standpoint, and as an employer, by the way, we offer both HSA and HRA options at different parts of the Essentia system. And so we do view it should be an option that's available to our employees as well as being a provider of service. The other part of that as a healthcare provider, where we're providing the service, so as you go more to consumer-directed healthcare, where individuals are not only involved greater in their decision making, but also involved in the financial risk associated with it. Let's make sure, one, they have the ability to make good decisions with that, and two, as a healthcare organization, because there's a lot of upfront deductibles or upfront kind of you pay the first dollar comes to you. There have been increases in when we receive bad debt and uncollectible accounts and such as a healthcare provider, because people don't fully understand perhaps the risk associated at times with their benefit design. Now, I think those are more exceptions than the rule, but it is something we have to
I mean, one of the
balance.
things that's shocking in America right now, every 30 seconds in America, someone files BK because of unpaid medical bills, the biggest driver of BK in this country. I mean, we really screwed this thing up. And so I guess, Craig, and again, you being politically savvy, understanding business, if you had a magic wand, one, what's your solution to this healthcare situation? And two, do we have the fortitude politically in this country to start to get something done?
Well, you know, Chris, the issue, and again, I spoke earlier about how a lot of businesses have waited, people have procrastinated. I think political figures have procrastinated. I think the first step was a Supreme Court. You know, people thought, we'll wait for the Supreme Court. Maybe they'll be able to repeal this law. That obviously didn't happen. You know, now they're waiting for the election. You know, there's so much that has to happen in terms of all these people and people campaigning on, we need to repeal this law. And I come back to the fact that that may be the case in some cases. There are plenty of good things that are included in this law. But the reality is there's a lot of things that have to happen to repeal it. And so you have these candidates out there talking about that. And it's the reality, as I said earlier, is it is the law, like it or not. And people and companies have to begin to plan what they're going to do to comply.
But on the flip side, I mean, it's one thing to repeal this thing. It's another thing to have a solution. Again, I'm not a rocket scientist, but even I can see the demography of this nation. And you look at the healthcare cost numbers along with the demography, it's not good now. It has been good for a long time. So to say that, hey, this was a 2010 situation, Chris, and or even if we repeal the deal, I'm talking about what do we do to drive down these costs? I mentioned, you know, LASIK surgery, cosmetic surgery. In your opinion, what's an answer?
Well, again, I'm not the right person to answer that because I'm not a healthcare expert, and these two are far better versed in doing that.
But do you any thoughts on it?
That's all right. I would say that there's two fundamental pieces. One is we need to change the way we pay for medical care to doctors and hospitals. We've been paying piecework. You do more, you get more.
It's incented.
We need to change to, paying Essentia and other health systems based on overall health outcomes. If they help you keep healthier, we should pay them more. We need to reverse the incentives. The second thing is we need to give you, Chris, and other people incentives and help so that you can stay healthy. Those are really the two things, how we pay for health care and how we keep people from getting sick in the first place.
I think you bring a good point. So what's your strategy to begin to incentivize me? Because studies show, I think it's like 88%, they go, hey, if I was incentivized to eat better, I would do it. What's your incentive to incentivize people to start to be more healthy?
Yeah, we do have some incentives out there. I think they're probably too mild. I think we probably have to up the size of the incentives and also increase the opportunities for people to use them and make it easier for people to use them. Now, we don't know for sure that money is going to motivate people to take better care of themselves. We don't know that for sure. I don't know that we know the silver bullet here, but we have to keep trying. We're living in a world that human beings have never lived in before. Most of us don't do physical labor to earn a living, and we're reasonably wealthy and we have plentiful, cheap food. so we're getting fat. Human beings have never lived in that environment before. We have to learn a new way of living, and you know, employers, individual employers, Blue Cross Blue Shield, and the health system all have to be involved in helping us figure this out.
But I guess that's the thing. Do we have the fortitude right now as a country to do that? Because you know, I look at it and I go, again, you guys don't have as many people at the hospital. You don't make as much money. Let's be frank. Most people are motivated by money. You're going to have lobbyists, all that, you know, web that we've woven. Can we undo it and start to get this thing on track?
Well, I think, I guess in weighing in on that, I think there's a, you know, from a pragmatic perspective, it is not sustainable in its current form. And you can then go to very draconian approaches where you talk about rationing, you talk about whatever, that none of us want to have those discussions. But I mean, there is a very shaky foundation here that as we grow forward and expand, will not be able to support the delivery system it's currently configured. So we've got to find, you know, new care delivery models. We've got to work collaboratively on improving overall health. We have to hold folks accountable to outcomes and quality. And you know what? The reimbursement comes on the back end of all that. It isn't what drives it to start with. And that's where that shift needs to occur. And we're making small steps, but not at the pace we need to make them.
Last question for both of you, and I'm going to give you the last word, Craig. Independent payment advisory boards, Sarah Palin calls them death panels. Will there be rationing at some point?
I think if you look realistically, healthcare as it's currently being delivered has rationing already built in it. We just don't talk about it.
Such as?
Such as people don't have access to care. If they, the affordability, if they make a decision not to go see the physician or delay it because of a copay or a deductible or an uninsured status, that is quasi rationing. And so
but
it's
if I'm
already
uninsured,
there.
I can show up to the emergency room and I get paid for it, correct?
Not necessarily, no. If you're insured, you do. You're right. If you're uninsured, no. We don't, as a provider, get paid for it.
You don't get paid for it, but
right.
I don't have to pay those bills according to the law from, what was it, 1986?
Yeah, but the most expensive environment in which to receive care is an emergency room, and it isn't care coordinated. It doesn't provide you good management of chronic disease states and other things. And so it's...
I mean, I understand all that, but again, if 25% of my income is going to my insurance premiums and I can't afford that, I say, well, too bad, I'll just pay the penalty for now.
And the reality is, if that's the direction we'll go, you'll see a collapse of the delivery system.
You know, and Chris, what we're going to get if we don't solve this is a Canadian-style system of some kind or another. And, you know, they do spend less in Canada. They spend about a third less on healthcare in Canada. And they do a good job with babies and car accidents and big cancer cases. So life-threatening and beginning of life, they do a good job. In the middle, they don't do a very good job. If a 50-year-old needs a hip replacement in Canada, they wait a long time to be able to get that kind of hip replacement. I don't think we want that kind of rationing in this country, and so it's really important that all of us, you know, you represent the individual consumer, Craig represents the employer, I represent private insurance, Kevin represents the healthcare delivery system. We have to work together to solve this if we want the kind of health care we're really going to feel good about.
Craig, I want to give you the last word, and I don't mean to lead you here, but I just want to share this. Rick Santorum said that Margaret Thatcher once said the reason Great Britain was never great again was because of socialized medicine. Are we going to a one-payer system with this deal?
Yeah, at times it seems like it, but you know, what Paul had mentioned earlier about your very specific questions, and Paul said, "This is easy. Is this easy to understand?" I remind you that this bill was over 2,000 pages, and very few members of Congress, I can guarantee you, read it. And so, employers, insurance companies, hospitals, whatever sector you represent or you're from, there are hundreds, thousands of unanswered questions. And what we're doing at the Chamber is, right after this bill became law in June of 2010, we had a seminar we put on where we tried to take a 50,000-foot approach to help our members begin to understand it a little bit. Both Paul and Kevin were a part of that. We're going to continue to do that as this goes on so that we can answer the questions that our members have, because it really seriously is a very complex, you know, and I think it's been said, it's you know, one of the largest pieces and probably most expensive piece of legislation that's been passed in the history of this country.
It's going to be amazing to see what the future holds. We should do this again next time. We'll bring in some couches. We'll have some beers and do this for maybe a couple hours. Yes, thanks a bunch.
Thank you,
Appreciate it, Craig.
Thanks,
Paul.
Thank you.
Thanks a bunch, Kevin. Thank you for being here with us on this web exclusive piece. Obviously very complicated. I don't know what the future holds with this thing, but when I hear Margaret Thatcher say that, are we going down the same path, or will 2012, November 6th, be a deciding factor on where we end up as a nation? Thanks.